Hello friends, assalamu alaikum. My name is Shahnaz Jannat and welcome back to my channel. I hope you all doing good. In my previous video I was discussing about the brachial plexus. So this is the part 2 video of brachial plexus. If you want to check part 1, then you will find its link in description below. First check that, then come here so that it will be more easier for you. So, and if you are new in this channel, so please first subscribe to my channel. So now move on to our today's topic. So now we will see the all branches of brachial plexus and also see the all muscles supplied by these branches. So this is our entire brachial plexus. Okay, these are roots, 5 roots, then trunks, 3 trunks, upper trunk, middle trunk, lower trunk, then 6 divisions, then 3 cords, lateral cord, posterior cord and medial cord. Okay, and we already saw the main 5 branches of brachial plexus. So our C5 root give here another branch. Okay, this is called dorsal scapular nerve. This nerve we can also call nerve to rhomboids. Because our rhomboids muscles supplied by this nerve. Okay, so this is the dorsal scapular nerve or nerve to rhomboids, and its origin from root C5. And our this nerve supply 3 muscle: rhomboid minor, rhomboid major and levator scapulae. So rhomboid major, rhomboid minor and levator scapulae. Okay, then another branch, then root C5, C6 and C7. These 3 roots together give another branch. This is called long thoracic nerve. Okay, this long thoracic nerve also called nerve to serratus anterior. And so you can understand from its name, this nerve supply our serratus anterior muscle. Serratus anterior. Okay, so from roots we get a dorsal scapular nerve or nerve to rhomboids, and it supplied 3 muscle: rhomboid major, rhomboid minor, levator scapulae. Then from C5, C6 and C7, these 3 together give another branch, long thoracic nerve or nerve to serratus anterior, and it is supply our serratus anterior muscle. Now our trunk. Okay, our upper trunk give 2 branches, 1, 2. Okay, 2 branches. This is suprascapular nerve. Okay, and this is nerve to subclavius. So our suprascapular nerve supply 2 muscle: supraspinatus and infraspinatus. and our nerve to subclavius supply our subclavian muscle. Okay. So upper trunk give two branches, suprascapular nerve and nerve to subclavius. Suprascapular nerve supplies supraspinatus muscle and infraspinatus muscle, and nerve to subclavius supplies subclavian muscle. But our middle and lower trunk don't give any branches. Okay. Then our cord. Okay, our lateral cord give 3 branches. We already saw 2, musculocutaneous nerve and median nerve. Okay, lateral cord give a lateral root of median nerve. Okay, so 2 we need another, so this is another branch, 3 branch. Okay, from lateral cord 1 2 3 branches. This is lateral pectoral nerve. Okay, and this lateral pectoral nerve supply 2 muscle, pectoral. So pectoralis major, then pectoralis minor. Okay, then our musculocutaneous nerve. Okay, our musculocutaneous nerve supply our BBC muscle. So this is our arm. This muscle are called BBC muscle, and our musculocutaneous nerve supply our BBC muscle or arm flexor muscle. So then median nerve. Okay, median nerve, lateral cord give its lateral root, and medial cord give its medial root. Okay, so this is lateral cord and medial cord together give median nerve. This nerve supply which muscle, that we will see later. Then our posterior cord. Okay, our posterior cord give 5 branches. One is axillary nerve, then radial nerve. We need another 3. 1 2 3, so total 5. 1 2 3 4 5. So this is lower and this is upper subscapular nerve. Then this is nerve to latissimus dorsi. Okay, so our lower subscapular nerve and upper subscapular nerve, these two together supply subscapularis muscle. Okay, subscapularis muscle, and our lower subscapular nerve alone supply teres major muscle. Teres major. Then our nerve to latissimus dorsi, this nerve supply latissimus dorsi muscle. Okay, then our axillary nerve. Our axillary nerve supply 2 muscle. Deltoid and teres minor. Okay, our lower subscapular nerve supply teres major, and our axillary nerve supply teres minor, so don't get confused. Then our radial nerve. Okay, our radial nerve supply our radial nerve supply all our extensor muscle of arm and extensor muscle of forearm. So radial nerve supply all extensor muscles of arm and forearm. Okay, so these 5 branch from our posterior cord. One is nerve to latissimus dorsi. This nerve supply latissimus dorsi muscle, then lower subscapular nerve and upper subscapular nerve. These two together supply subscapularis muscle, then lower subscapular nerve supply teres major muscle, then our axillary nerve. Our axillary nerve supply 2 muscle, deltoid muscle and teres minor. Then our radial nerve supply all extensor muscles of arm and forearm. Then our medial cord. Okay, medial cord also give 5 branch. Medial root of median nerve, ulnar nerve, and so 1, 2, 3, 4, 5. So this is for arm and this is for forearm. This is for arm and this is for forearm. Medial cutaneous nerve. Okay, then this one is medial pectoral nerve. Lateral cord give lateral pectoral nerve and medial cord give medial pectoral nerve. And medial pectoral nerve also supply these 2 muscle, pectoralis major, pectoralis minor. So medial pectoral nerve and lateral pectoral nerve, these 2 nerve together supply pectoralis major and pectoralis minor muscle. So I am writing here pectoralis major and pectoralis minor. Okay, then our medial cutaneous nerve of arm and medial cutaneous nerve of forearm. These 2 nerve don't supply any muscle. These are 2 nerve for sensation of arm and forearm of medial side. So then our median nerve and ulnar nerve. Our median nerve supply all flexor muscle of forearm. Okay, or flexor muscle of forearm except flexor carpi ulnaris. Okay, flexor carpi ulnaris, this muscle supplied by ulnar nerve. Okay, then another exception, our flexor digitorum profundus. Okay, its lateral half supplied by median nerve and flexor digitorum profundus, its medial half supplied by ulnar nerve. Okay, then our all thenar muscle, hand muscle. Okay, all thenar muscle supplied by median nerve except adductor pollicis. So our abductor pollicis brevis, flexor pollicis brevis and opponens pollicis, these 3 supplied by median nerve. Then our all hypothenar muscle, okay, all hypothenar muscle supplied by ulnar nerve. Then our lumbricals, first and second. Lumbricals supplied by median nerve and third and fourth lumbricals, and first and second lumbrical supplied by median nerve, and third and fourth lumbrical supplied by ulnar nerve. Then our all dorsal and palmar interossei. Okay, so all our dorsal interossei muscle and palmar interossei muscle supplied by our ulnar nerve. So our medial cord give 5 branches. Median 1, 2, 3, 4, 5. Medial pectoral nerve supply pectoralis major muscle, pectoralis minor muscle. Then our medial cutaneous nerve of arm and medial cutaneous nerve for forearm. Then median nerve, ulnar nerve. Median nerve supply all flexor muscle of forearm except flexor carpi ulnaris and our flexor digitorum profundus. This muscle supplied by two nerve. Okay, its lateral half supplied by median nerve and medial half supplied by ulnar nerve. Then all thenar muscle except adductor pollicis or OFO, okay, supplied by median nerve. Then all hypothenar muscle supplied by ulnar nerve, and all dorsal and palmar interossei muscle also supplied by ulnar nerve. Then our first and second lumbrical supplied by median nerve, and third and fourth lumbrical supplied by ulnar nerve. So now some clinical points. Okay, this is our upper trunk and this point is called Erb's point. Okay, because if a 6 nerve united together, this point is called Erb's point. Okay, so this is our Erb's point. Injury to this point is called Erb's paralysis. So this is our upper trunk injury, Erb's paralysis. If our lower trunk injured, then for that have another name. Okay, that is called Klumpke's paralysis. Klumpke's paralysis. So upper trunk injury is called Erb's paralysis and lower trunk injury is called Klumpke's paralysis. So this is all about our brachial plexus. And one more thing, our brachial plexus come from our anterior rami, not for posterior. Okay, it come from anterior or ventral rami, and our brachial plexus supply all our upper limb muscles. I already made video about all upper limb muscles. If you study that, you will be more clear about all muscles and their nerve supply. So I hope today's video is helpful for you. If this video is useful for you, please subscribe to my channel and I will be back with a new lesson. Till then, take care. Allah Hafiz.